pen go?
All right, whenever you're ready, Mr. Brennan.
Thank you, Your Honor. Good morning, sir.
Good morning.
Could you please introduce yourself to the jury, spell your first name?
They removed a juror? What? Good morning. I put the new stickers in, guys. That's too much, Michelle. That was too much, Michelle. Sorry. They did not remove a juror. So, you guys, with this, there's going to be a lot of conflicting information, so we're just going to have to be patient with it. We're just going to have to be patient with it. We don't know what happened. We don't know what they were questioned about. We don't know. And the lawyers can't tell us because there's a gag order on the case. We'll just have to see what Karen says after court today. Or during a break, maybe. Are you serious? They separated grown-ass adults? Thank you for the follows. Yeah, guys, please remember when you're in here, if it's opinion or a rumor, put IMO, please. Put in my opinion at the end, just to cover my butt. Thank you. No, this is Lori Daybell. Lori Daybell's third trial starts on June 2nd. And this will be her last trial, if she doesn't get any appeals anyways. It's for conspiring to unalive her niece's former husband. But we need to figure out what we're going to do for that, because we'll have two cases at once. I don't know how to time manage that. I don't think I could do this to where we start like a day late. I'm going to have to pull like 12 hours on TikTok for us to cover this. How? So if you guys would start brainstorming, I could use the help. Help me figure this out, please.
Name and last name for the court reporter.
Sure. My first name is Isaac, A-I-Z-I-K. It's phonetic. Last name is Wolf, W-O-L-F, like the real thing.
What do you do for a living?
I'm a brain surgeon.
Is there a special part of medicine that you study?
Well, my main interest in brain surgery is brain tumors and trigeminal neuralgia. But I also specialize in movement disorders. I do pediatrics and adults.
Are you an active working neurosurgeon?
I am very active working neurosurgeon. I get up every day at 4:30 in the morning to go to work. 5 days a week. I take call 300 days out of 365 days a year.
Did you work yesterday?
Yes, I did.
What type of work did you do yesterday?
I did 2 brain surgeries yesterday.
Are you working tomorrow?
I have 4 surgeries scheduled for tomorrow, which is why this is a little bit delayed for me, and I have 4 on Friday.
And what type of surgeries do you have tomorrow and Friday?
I have 3 brain tumors, 1 trigeminal neuralgia, and on Friday I have 4 patients with movement disorders.
You're here today as a witness. How much of your practice, how much percent of your income is from being a consultant or a witness for a case?
Probably less than 1%. I don't do this for a living.
Education and background. Could you share with us medical school, where you graduated from?
I went to Yale Medical School. I graduated summa cum laude.
Was that in 1981 that you graduated?
Correct.
After medical school, did you begin internships in medical residency?
I did an internship at Hennepin County Medical Center, which is a trauma center in Minneapolis. I then did 5 years of neurosurgical residency at the University of Minnesota.
And was that in Minnesota?
Correct, in Minneapolis.
Is there something about that hospital that has some specialty?
It was one of the #1 training centers for chairmen in neurosurgery.
Showers, I bought you a subscription so you could use the stickers too. I appreciate you being here every day. I really do.
At the time.
Did you, in your residency and your fellowships, do any work or study in pathology?
During your residency as a neurosurgical resident, you do 6 months in neurology, you do 3 months of neuroradiology, you do 3 months in pathology, which includes autopsies on brains. And then you do rotations through a trauma center.
I want to pick one more person. So we need a way, and it needs to be completely fair. So if you guys want to be considered for winning another subscription, put a 1 in the chat, please.
As a chief resident through a VA hospital, and then ultimately at the university hospital for elective cases. We
already
also
have
do
one,
6
Brandy.
months of pediatric.
Brandy, you already got one. Hold on. Hold on. I appreciate you, Lisa. Who has pregnancy brain? Because I sure am not pregnant. I may look it, but I'm not.
Neurosurgical residency.
You should be able
Did you
to. I just sent it to
Do
you.
a fellowship at New York University.
Yeah, at NYU, I did a fellowship before I went to the University of Maryland as a professor in brain transplantation. The interest was in using cells to create dopamine centers in rat brains with the concept of Parkinson's being curable with transplantation.
I'd like you to take us through some of your faculty positions.
Oh, your pregnancy brain. I was about to say, I mean, I've dreamt of it happening, but it never happened. And this is just all from eating too much food and not having a good thyroid.
And so you can share with us some of the progression of your training and experience. And did you begin at the University of Maryland Hospital?
Yes. In 1987, the University of Maryland recruited me to start their epilepsy surgical program and skull-based program. And then part of our responsibilities as assistant professors was to cover shock trauma.
Could you explain for us what shock trauma means and whether the University of Maryland Hospital was a shock trauma hospital?
So the University of Maryland and shock trauma were actually two separate entities when I started. A man named Cowley had basically developed the concept of the golden hour. So prior to Dr. Cowley, most trauma was just taken locally. That meant as a community hospital, if a patient had been in a motor vehicle accident, they needed an orthopedic surgeon, they had to call the orthopedic surgeon in, could take 15 minutes.
We don't know because they just started up. We don't know. Apparently, we all got worked up for nothing. We don't know. All right, I'm writing out the names for the people that want to be considered for the other subscription. So I'll pick it in a minute. Yes, seriously. Now we have Isaac Wolf. Okay. If there's anyone else. Hi, LT, how are you? Yeah, Wolf like the real thing. Neurosurgeon like the real thing? I mean, we have to ask, inquiring minds. Thank you, JK. This is Isaac Wolf. I wasn't kidding. That's his name. He sure the hell can get an award for the coolest name. Yeah, he's the neurosurgeon, yes.
Take 3 hours. The same thing for a vascular surgeon, the same thing for a neurosurgeon. Dr. Cowley came up with the concept that you needed a center that was strictly for trauma, and every attending had to be in the hospital 24/7. So that was the concept of shock trauma back in the 80s.
Everything okay?
Yeah. I'll be right back. I'm going to get the.
I'm sending people free subscriptions. I'm buying them subscriptions
Why?
because they deserve it. $5.99 each.
When I got there, we were transitioning from a very
Good
small
morning,
center
Renee.
to a 125 bed hospital that was completely committed to trauma.
In that experience, in the years you worked there, did you have an opportunity to treat a number of people with brain injuries?
We treated well over 100 patients a year, a month basically, with brain injuries at shock trauma, along with spinal cord injuries.
Did you perform surgeries in different types of brain trauma and brain injuries?
Yes.
After Maryland in 1993, did you move to Miami Neuroscience Center?
Yes. In 1993, I left academics. I went into private practice.
I don't know what happened, but I paused it the second it turned red, and I've been trying to fix it this whole time. Oh, you do? Okay, I'll make that one. I'll make the heart and arrow one later. Yeah, that's right. I totally forgot about her because it was that quick. Okay. So I don't know if y'all heard the last thing I said. I don't know if y'all put the ones in the chat. But if you guys want to be on the list for one more free membership, put a 1 in the chat, please. Okay, I think I got you guys. Right, Robbie? He for sure did. It was when I told him and he went out to get in the car that it happened. Excuse me. I have some good news though. As we wait for people to come back in, I have good news. They just opened up 10 more sticker slots for us. Do you understand what this means? We don't need that part of Michelle. Yes, we're back. Okay, now let me figure out how I'm going to figure this out. We'll go back to court now. This is right where we left off. This is Dr. Isaac Wolf, the neurosurgeon.
Are you presently the director of the Miami Neuroscience Center at Larkin Hospital?
Yes, I am.
Do you conduct a number of surgeries a year there?
Correct. So I spent 19 years at Doctors Hospital, then we moved to Larkin Hospital 13 years ago, developing the new radiosurgical unit called ZAP, and also another fancy machine called high-frequency ultrasound to treat the movement disorders.
You've noted that you have a number of professional memberships. I don't want to go through all of them. I'd like to point out a few. Are you a professional member of the American Association of Neurological Surgeons?
Yes.
Are you a member, a fellow American of the College of Surgeons?
Yes.
Are you a member of North American Skull Base Society?
Yes.
And is that brain related?
It is.
Are you
I'm not going to lie, when he said Skull Base Society, my mind went straight to that movie. You know what movie I'm talking about, right?
a member of the Society for Neuro-Oncology?
Yes.
Are you a member of over, or at least 34 different professional memberships?
Yes.
Catnip. Pick a number 1 to 15.
In your career, have you engaged in research?
Yes.
Has that research focused or centered on brain injury?
Yes, it has.
Is some of your research as a principal investigator for THAM treatment of brain tissue acidosis in severely head-injured patients?
Yes.
Did
Jamie,
that research
pick a number
and
1
as a
to
principal
15.
investigator help you in your diagnosis and treatment of brain injuries?
It actually was in the treatment of severe head injuries, patients who are unconscious. The concept of trying to relieve the increased intracranial pressure that occurs from the injury and to increase blood flow, thereby increasing oxygen to the brain.
Jamie, are you here? Sandra, I need a number from 1 to 15 from you as well. 1 to 15. Renee sent 1 subscription. Thank you so much, Renee. There you go. I'm doing this a really weird way.
Did you
Parker,
also serve
Parker, pick a 1 to 15, will you?
as principal investigator for research for the PEG, SOD, and severe head injury?
Yes,
Could you describe that very briefly?
basically the same,
To be abundantly honest, we're here early because they had all the jurors one at a time go to sidebar to be questioned. We don't know why. We don't know what happened. We don't know if anyone was replaced. We don't know. Then they just start There we go. They're trying me today. Whoever is trying me is trying me. Do not take away our internet. This is our last day of the week that we get to watch this. The hell? Thank you. I don't know why that happened. Wait, do we have a half day tomorrow? Yeah, wait, no. Okay, so we got a day and a half. But still, don't mess with us. We cannot miss this. We're too invested.
You know, one of the biggest problems in brain injury is the fact that blood flow ceases to exist as the brain swells up.
Jamie, can you pick a number 1 to 15, please?
And so one of the things we try to do is preserve the neurons by making sure that they have enough oxygen and blood flow to them. All these are agents that try to assist that.
I won't go through all of your research and principal investigator roles, but I want to ask you about one more. And that is, did you serve as principal investigator relative to the IRB protocol for brain pathology?
Yes.
And what did that do? What was that about?
It was about looking at what happens after
Parker, 1 to 15, please.
brain injury to blood vessels and tissue as the intracranial pressure increases in the brain.
Have you been part of publications of a number of different books?
Yes.
I won't list parts of all 16 books, but can I point out a few?
Sure.
Were you the author of a book chapter regarding head injury, difficult medical management?
Yes.
Were you the author of a book chapter on pediatric neurosurgical emergencies?
Yes.
Were you the author of a book chapter on complications of head injuries in adults?
Yes.
Were you author of a book chapter, Imaging of Craniocerebral Trauma?
Yes.
Were you...
We need one person to pick a number. Who do we have pick this time?
Yes.
Were you the author of a book chapter, Intracranial Injuries?
Yes.
I won't list or ask you about the other book chapters that you've been the author of. Have you been involved in journal articles?
Yes.
I'd like to ask you just about a few of the 70 journal articles that you have published.
Your Honor, objection.
So go ahead and ask the question without a comment, please.
Were you an author of a journal article, Intracranial Pressure in Non-Traumatic
Susan, pick a number 1 to 3. I'm sorry. Pick a number 1 to 3,
Ischemia
Susan.
and Hypoxic Cerebral Insults?
Yes.
Were you the author of a journal article, Post-Traumatic Cerebral Infarction?
Yes.
Were you the author of the journal Fractures of the Clivus?
Yes.
Could you tell me a little bit about that paper?
We used thin cut CT scans
Susan, can you hear me?
to identify fractures of the skull base. Prior to CT scans, it was very difficult to actually identify radiologically a skull fracture with plain x-rays. The idea was to see if we could identify them more clearly, and so we classified them and delineated them in the paper and discussed the outcomes that were relative to those type of injuries.
In the last journal article I'll ask you about, were you the author of a journal article regarding acute traumatic midbrain hemorrhage?
Yes.
Were you the presenter in a number of presentations regarding head injury and brain injury?
Yes.
Mrs. Bubbles, you win. Pick a number for 1 to 3. I need you to be our picker. 1 to 3. 1, 2, or 3.
You've listed 93. I'll ask you just about a few. Were you a presenter in fractures of the clivus, clinical and radiographic features?
Yes.
Am I pronouncing that correctly?
Clivus.
Thank you. Were you the presenter in acute head injury?
Yes.
And a separate presentation, fractures of the clivus, classifications and clinical features?
Yes.
Do you lecture?
Yes.
Do you have peer-reviewed publications?
Yes. That was one of them.
Thank you. And are you heavily involved in clinical research?
Right now, my research is more based on radiosurgical techniques and outcomes.
Over your career and your study and your clinical experience, have you treated different types of brain injuries?
Yes.
Are you familiar with a number of different types of brain injuries?
Yes, we still treat them.
Were you asked to review materials relative to this case?
Yes.
And do you recall the materials that you reviewed?
Yes.
Could you share with us some of the materials that you reviewed?
I reviewed the chief medical examiner's assessment of the case. I reviewed pictures that I'm assuming the medical examiner took of the autopsy. And I reviewed the report from the forensic pathologist.
And before I ask you about your review of specific materials and your opinions in this case, is there a benefit to your clinical experience in studying brain injuries as opposed to the experience you had as a fellow simply with pathology?
Well, I think that for the jury to understand is a clinician understands the process from the time the injury occurs till the patient. And as a neurosurgeon, is with that, if that's what you're asking me.
Yes. And so, doctor, you reviewed a number of items of information in this case. Did you have an opportunity to review photographs of a laceration to Mr. John O'Keefe's head?
Yes, I did.
With the court's permission, I'm going to
Alyssa, you won, and Kat, I sent you one as well.
ask to display Exhibit 160.
Okay.
Dr. Wolf, I'm going to ask you to take a look at this photograph. Have you seen this photograph before?
Yes.
I want you to explain to us what you're seeing here and take us through the process of your observations.
Well, what we're seeing is an approximate 1.5 inch laceration with bridging tissue
Thank you, Catnip.
and contusions and abrasions.
Peachy, Catnip just sent you a subscription.
To us, that's just a classic blunt trauma injury. There's nothing other than just vanilla about it. This is what happens when
Thank you for subscribing, Robbie.
soft tissue hits a solid ground. The skin tears apart a bit, but not through and through. As you can see, there's the bridging. You can see all the bruising or contusions and just the tear, a little bit serrated along the edges.
Thank you. If you could take that down. Dr. Wolf, as a result of that wound, did you have a chance to further look at information?
When we get to 80, it gives me free subscriptions to send out so I won't have to pay for them. I don't make money like that. So I can only do the two I promised and then the one extra. Sorry, guys.
Provide to you about the actual inside the skull of Mr. John O'Keefe.
Yes, it was the pictures that I was reviewing showed a non-depressed skull fracture extending linearly through the clivus and into the frontal fossa of Mr. O'Keefe over.
And it just put us on a subwave too. So it wants us to get to 8. So 2 more subscriptions. Maybe it'll give us, maybe if we get it, maybe it'll give us freebies. I don't know. But when we get to 80, then I'll get to send out freebies that I don't have to pay for. Thank you.
Over the orbit roofs. He had fractures along the temporal fossa as well. So it was a classic linear basilar skull fracture.
Is basal skull fracture a
It's
characterization?
basically the base of your skull is what it encompasses. So the opening at the very bottom is what we call the foramen magnum that connects your brainstem to your spinal cord. And then as your brainstem goes up, it goes into the different skull areas that, talk about what we call the cerebral cortexes, your occipital lobe, your temporal lobes over here, and then your frontal lobes.
So can you walk us through what happens when someone incurs this type of injury to the back of the head, how it happens, and what are the next steps for a person?
So what happens is, you fall backwards, and the linear acceleration starts to take you back down with gravity. The skull hits the ground. It
Renee just sent 1 more subscription. Presley, you just got a subscription. Thank you so much, Renee.
gets, in layman's terms, smashed a little bit. And then the brain moves forward as a response to that. And it moves forward
Parker.
because you have
Dev's Life, you just got a subscription from Parker. Thank you, Parker.
cerebral spinal fluid, and because you have the deceleration, acceleration again. As it does, your skull, if you were to look inside your skull, it's like mini mountains along your temporal bones and your frontal bones.
It says that we could win prizes if we get to 10. I don't know what that means, so I'm not going to promise anything. I don't know what it means.
The brain is being thrust forward at a fairly good speed, and it's getting bruised. You can think of it as if you took a hammer to your thumb. It's really turning black and blue. Those are the contusions. And so the temporal poles and the frontal poles are getting contusions because of that. At the same time, you have a space called the subarachnoid space. And I'm sure they're going to hear about the subarachnoid hemorrhage. And that space is it's very clear, thin membrane that covers all of your brain and all of your spinal cord. And
Renee just sent out another subscription. Samantha P, you got a subscription. And Mrs. Bubbles just sent one out. Whatever, BK, you just got a free subscription. Thank you guys so much. I appreciate you guys being there for each other like that.
normally, you really don't see it unless you open up the brain and you're operating.
What does this mean?
But when you either have a traumatic event like this, where little vessels are pulling apart underneath that membrane, or, for example, the classic, when you have an aneurysm burst, the space that the aneurysm bleeds to is the subarachnoid space.
What are the odds that we get dinged for the words being, because he's talking about gross stuff? Don't ding us for that.
Membrane that covers the whole brain and also right down your spinal canal. And it's a very thin membrane that looks like very thin leather. And in that space between the brain and the dura can be a lot of veins that go towards a central vein called the sagittal sinus. And if those tear, you have a venous hemorrhage from, which is not arterial, so it's not quick, but that can develop into a subdural as well. If you tear a portion of your brain as well, and you get a little arterial bleeds, that could create a much faster subdural hematoma.
Because they're giving me extra wrinkles today, I put on some scar tape to see if this helps at all.
And so when you look at the pathology,
Sure.
the autopsy of his brain, you're looking at a subarachnoid hemorrhage, you're looking at a subdural hemorrhage, neither one of them which was huge or would have required surgery, as well as the contusions. that I described in his frontal poles, in his temporal poles, and then the original bang, which was in the occipital area. These are all findings that you would see on a CT scan and an MRI scan without requiring an autopsy if he had made it to the emergency room.
I want to take a step back at the beginning. You said that this laceration on the back of his head was caused by a fall. Could this be caused by a fall landing on hard ground?
Yes, I mean, like I said, it's a classic blunt trauma laceration.
Do you have an opinion to
Catnip Medicute sent me a brand new mask that they have. Thank you for extending your subscription.
reasonable degree of medical certainty whether this injury,
Thank you,
the
sugar.
laceration and the basal fracture, was caused by Mr. O'Keefe falling backwards on the ground?
Thank you.
My opinion is that that's what caused his whole injury.
The pattern of the laceration, do you have an opinion whether that is consistent with
I don't.
hitting the cold, hard ground?
Objection, Your Honor. Could we have sidebar on that, please?
So I'm sustaining the objection, so no sidebar.
The fuck?
Do you have an opinion, doctor, about whether that laceration on the back of his head was caused by a particular movement?
Well, the only way he could get this kind of an injury was to fall backwards, hit the back of his head, and then the resulting, energy forces going into his brain, into his base of his skull.
Would that type of laceration require Mr. O'Keefe to have hit a line type or a ridge type object?
A ridge type of object?
Yes.
No, I mean, like I said, the tearing of the skin in that fashion, you could look it up, would be just a classic blunt trauma injury.
Is there any
Yes, we had to start early today because something unprecedented happened, and that was a jury was brought back in. And then they were told that they're going to be brought in one at a time and brought to sidebar because something was brought to Bev's attention. They did that. We came live for that because we didn't know what the hell it meant, and we were getting stomach aches because we were that worried about it. But we have no idea what it was about because then they just started like day as usual. And after having that much excitement, we couldn't just wait.
anything about that injury that would suggest to you it had to have been something sharp or ridge-like to cause?
Riv-like
Objection, Your
bleeding.
Honor. Again, request kindly a sidebar on this.
All right, we'll come to that.
Thank you.
100%. She denied his sidebar request on the last question. You heard that, right? He said objection, sidebar, and she sustained it. Mr. Jackson is on his toes. You guys should be proud of your husband. Let me see here. I'm trying to decide if I should try this mask. It's a night one. You're supposed to put it on at night and leave it on while you're sleeping. But, I mean, exactly, Kelly, exactly. I have all this nervous energy in me now. I can't get rid of it. Whoever messing with my internet. Oh, whoever's messing with my internet needs to stop playing. This is not funny. This is our Karen Read time that we specifically designate for this moment. Stop freezing us and disconnecting us. We're here for Karen. This is our time. No, you didn't get it because I lost connection twice, so it probably, in theory, hasn't gone much further. I don't know. So which guy is the guy that had hit her before? I saw somebody say something about, hold on. I think they are trying to tell us something today. Carl Dougal. He assaulted Karen. Who is that? I don't know who that is. Gotta remember, in here we didn't watch the last trial. We're doing virtual jury, so no bueno. You feel so lost? Well, they're on the first witness. We came on early because they had the jurors come in one at a time because something was brought to Bev's attention. She interviewed them one at a time at sidebar with the lawyers present. And then they came back and we have no explanation. This is Isaac Wolf. I do remember that text, and I think that text is what it doesn't say that says a lot. That's just my opinion, though. Catnip, they sent me a new mask. Medicube did. It's their, I don't know how to say this word, so I'm not going to try. Acid turmeric night wrapping mask. I don't even know. I know. Hi, Joanne. I'm doing okay. How are you? I got this yesterday. I got something else too. Let me go grab it. Gotta do something to get this nervous energy out. All right. Are we ready to continue? I don't know why it keeps messing with our connection, you guys. What doesn't make sense is it doesn't mess the connection from the other one. So it's my account. Yeah, Medicube is the good stuff. Yeah. All right, let's continue. I'll be right back. I have to go get something. Ow.
So as we were discussing, Dr. Wolf, you said this is a classic fall backwards. Is there anything about the pattern of that laceration that would suggest that there was a ridge or a line type edge that caused that wound?
Not necessarily.
And have you seen, in your experience, similar types of lacerations and breaks caused by falling on hard ground?
Yes, you can see that both in the occipital region. You can see it if patients fall on their, forehead. The skin tears, they're still bridging, and then they get bruises.
Some of your work was in Minnesota.
Correct.
Was it a colder part of Minnesota?
Very cold part of Minnesota.
Did you-
It's Minneapolis.
I'm sorry. Did you often see these type of injuries there?
Yes, I mean, we took care of a trauma center, Hennepin County. Very frequently, patients that are drunk fall down on ice sidewalks and could develop, lacerations in their head, epidurals, which are blood clots above the dura because they fracture a bone in the temporal area and they can get a bleed from a fractured artery. And it happens when people are shoveling snow and have a heart attack and fall backwards. So there are various ways that people fall, resulting in head injuries and lacerations to their forehead or to different areas of their head.
Can somebody suffer this type of injury simply by falling backwards?
Absolutely.
You had taken us through the process of falling backwards and then talked about what happens to the brain. Can I ask you a couple of detailed questions about that?
Sure.
When you explained that the brain upon impact then shifts forward and hits the front of the skull, is there a medical term for that process?
This is the stuff that just got released last week, Catnip. Guys, Medicube is on point. Good question, Patricia. So this one, you open the pouch, and then you pour the contents into the container.
Well, the medical term is a coup counter coup injury. So the coup is when you first hit. In this case, it was the back of the head, as summarized by the laceration in the back of the head, and the contusions that the pathologist and the ME found in the back of the brain. And then the brain shifts forward, and as it's traveling at a certain velocity, because it's thrust forward on the floor of the base of the skull, it's getting bumped, and it's getting, again, you can think of it as a hammer hitting a thumb. It's getting black and blue in the areas that are sharpest.
Are there symptoms that result of the process coup counter coup?
This is clinically, it varies. I mean, you can go from anywhere from a simple concussion where you sort of are unaware of what happened, but
These are not wipes. These are face pads. So cut them in half if you guys get this. Cut them in half.
you're still awake, you're confused, all the way to, ultimately being in a coma.
Can this type of injury, the coup counter coup, and what you see in the review of your files, could this type of injury happen from an attack by a weapon, like a bat or a hammer?
Well, he did not have a depressed skull fracture. So any focal hit like that would
Trigger warning.
more likely than not have caused a depressed skull fracture. Blunt trauma, the way he had, the assumption, would cause the coup counter coup without a depressed skull fracture.
When the coup counter coup process happens with the skull fracture, does anything happen to the front of the skull?
Does it, Kayla?
Well, you're asking me, does the rest, I mean, the forces, depending on how hard they are, can generate fracture lines all the way to the anterior fossa. So you can have fractures along the lateral temporal area. You could have fractures along the orbital roof. The orbital roof is very thin.
No, Debbie, don't you worry about that. We have people in here that are working too. We don't mind it. We encourage it.
And so those forces can go all the way to that area.
Did you see any sign of orbital fractures in Mr. O'Keefe?
Yes, he had
For once, it's not.
He had
mine.
both the ME and the pictures taken, and the neuropathologist mentioned fractures of the orbital roof.
Do you have an opinion to a reasonable degree of medical certainty how those fractures occurred?
From the trauma.
Keyword, opinion.
Could you just explain a little bit how that would happen?
Well, as he fell backwards and he struck his head, it was clearly at a very high speed generated by the gravity. The bone, depending on the quality of his bone, the density, then generated forces. There's a certain amount of lateral give, and then you get a linear force going forward. It drives all the way up the clivus and forward into the anterior fossa where his orbital roofs lay. And this is why people like this get what they call raccoon's eyes.
Do you have an opinion?
Hold the hell on. We had the medical examiner up last week, and we remember that she said you cannot get the black eyes from falling and hitting the back of your head. You remember that, right? I remember.
Whether
it.
the brain itself could have caused the orbital fractures?
No. The brain is a soft substance. You could literally put your finger through the brain. We often operate on people fully awake. The brain couldn't possibly cause a fracture. The fracture was caused by the forces generated through that clivus.
Keep in mind, the medical examiner said they would not rely on a neurosurgeon's opinion. Keep that in mind. I remember that. You guys remember that too, right? So again, if you guys get this one, cut them in half, and then you got to put the liquid in.
Middle bone in the middle of his base of the skull.
Do you have an opinion to a reasonable degree of medical certainty
I know.
whether or not the brain in any way could have caused these orbital fractures?
The answer is absolutely not.
In your study of the records and photographs, and in your experience treating these types of injuries, do you have an opinion to a reasonable degree of medical certainty whether or not a person would remain conscious or would be immediately unconscious after the impact of the ground?
Not drinking.
Well, it's impossible to know what
Medicube sent me their newest face product. Just came out last week, or I think it was last week. So it could just go with last month. You get a baggie, you cut the face pads in half, and then you pour it in. Make sure you cut them in half. If you guys get this, it'll come with the pads that look like you wipe your face. That's not what they're for.
whether he became immediately unconscious.
Yes, I do.
But his injuries were very substantial.
My YouTube is Michelle's Criminal Musings.
And it's more probable than not that at some point he quickly became unconscious and was unable to do functional activities.
What does functional activities mean?
The ability to, get himself up and about would be one of the functional activities. The ability to call for help would be a very significant cortical function. And that's why I was talking.
It's probably really rude if I eat my Nacho Bel Grandes while in life. The crunching would drive them crazy.
You want your burrito?
Yeah.
About, that there's a variation on the theme from a simple concussion to a severe concussion like this.
PDRN, Pink Collagen Toning Gel Toner Pads. I can't. I know it will drive some of you crazy.
If a person
I don't know.
does not have functional abilities because they are rendered unconscious, does their body, could it still move?
Okay, babe, I guess they're okay with me munching in their ear.
Yes, this is the interesting thing about our brain. So
Right, Kat?
the cortex, which is the top portion of your brain, can get separated.
How the hell am I going to mute myself,
your
Kelly, when you
brainstem
guys are hearing this through my phone? I can't.
Functionally, and what happens then is that your body is not acting autonomically, meaning vegetative. So why does that happen? We think it's because as we were a caveman, and if a caveman became unconscious,
The hell? You're going to use going back to when somebody was a caveman for this? And you expect to... Is he messing with us?
I don't know. I would have just said that that's how the bodies are designed.
Thank you, CS. Yes. I don't know where they're at because they started the day with bringing in the jurors one by one for a sidebar with the lawyers for something that was brought to Bev's attention, and we have no idea what that is. Nobody will until later.
Burrito in the fridge.
Okay, thank you.
an animal came up to eat it, the animal would touch it. Well, you have these automatic movements.
Sir, some of us are sitting down to lunch, please.
One of them is called decorticating, which is where you draw your arms like this and you throw your feet out. And then a worse neurological situation is when you decerebrate. Now you push your arms out along with your legs. And that would scare off an animal. So we think that over time, genetically, this is what happened to our brains in order to create these. But those kind of movements are not.
Is he effing with us? Is he being 100% serious right now? Cavemen and hunting animals. The hell?
thought processes. In other words, your brain is not telling you, oh, you have pain, go ahead and decorticate or decerebrate. It's an automatic movement in response to pain.
I want you to take us back now to after the fall. Would Mr. O'Keefe, in your study and opinion, have died immediately?
No.
Can you
I
share?
don't, yes.
I'm still here. I'm just over here eating my nacho grande. You all approved it. Remember that.
So there is very few things that you head injury where you would die, quote, immediately. So if I took a knife and stabbed you in the back of your neck, right below your skull, and I drove it through your brainstem,
Holy
you would
hell.
probably die.
You're
immediately.
talking about stabbing people in the
If I-
brains now? The hell? If anything ever happens and I ever need a neurosurgeon, this is not the guy for me. Make sure Aaron does not hire Isaac Wolf, please.
I shot you below your ear and went through and through below your ear and shot through your brainstem, you would die immediately. But
You're
traumatic head injuries,
You paint such a sunny picture. Thank you so much.
you would not die immediately. It's a process. And it's a process of a combination of things. Brain swelling, which takes a while to develop.
I don't know, Corey.
Decreased blood flow to your brain because you're getting swelling. And ultimately, death of the brainstem that controls your heart and your breathing. And so this is why there's a whole big issue about brain death. You know, when is someone brain dead?
I'm trying to.
Because it's not instant and it can take a long time to be conceived. In these injuries that are very severe that we took care of, there was a high mortality rate. In the linear skull fractures, it was about 67%. But it took time for them to die. It could take days to weeks to months. And also, these people got to shock trauma. So it was a while, whether it was hours, before they were even starting to be taken care of. And yet they weren't dead yet. That's why I don't think it was immediate.
Again, trigger warning.
Was there any other observations you made about Mr. O'Keefe or his body that support your opinion that he didn't die immediately?
Well, the medical
No.
examiner took pictures
This is Commonwealth.
of his periorbital area and diagnosed raccoon's eyes. So raccoon's eyes occur because there's leakage through the orbital fractures into the periorbital space.
Some of us are on their lunch break, sir.
Normally, it takes about 24 to 48 hours to develop. It has been noted as early as 1 to 3 hours, which would make it not immediate.
Could we please have Exhibit 14? Dr. Wolf, could you share with us what you see here in this picture?
So right here, you can see the black and blue
Do not
that
show it.
sort of configures, if he had his eyes open, like what we describe as raccoon's eyes. Right? And that's not caused by direct trauma to his eyelids. It's caused by what I described as the basilar skull fracture, which went to the anterior fossa, which is right over the orbit here, inside with leakage of blood products into that periorbital area.
You're ruining my nacho bel grande,
You
sir.
mentioned that starts or takes at least 1 to 3 hours to begin.
Minimally, yes.
You take that down, please.
Tell me you're being
Mr.
without telling me you're being.
O'Keefe had been brought to a trauma center or emergency room, what would the process be in your experience?
Well, he would have been intubated if he wasn't intubated in the field. One of the first things you need to do in a head injury is control the airway. Why? 2 reasons. One, you want to have enough oxygen going to the brain to feed it. And 2, you want to keep your carbon dioxide down because that causes increased intracranial pressure if
Thank
it
you,
elevates.
Charlie.
So you want to constrict the blood vessels a little bit. Then he would have had a CT scan immediately in order to assess whether he has a surgical head injury, meaning he needs to go to the operating room to evacuate something, or not. During that process, he's obviously going to be getting medication to decrease the brain swelling. And from there, you make decisions based on his neurological function and what you're, capable of doing to, spare the brain from the rest of the injuries that will result. One of the things that occurs with contusions is a great medical term is they can blossom, which means they can get bigger. And if they get bigger, they might require surgical intervention to decrease the pressure as well as the volume of the blood that's destroying brain. And so you do serial CT scans in these patients over time, anywhere from every 6 to 12 hours to on a daily basis, depending on what the case by case, production of blossoming is occurring.
You mentioned that about 2/3 of your patients who suffer this injury pass.
Correct. What we saw is that in the patients that suffered linear clavicle fractures, 2/3 of them ultimately went on to die, and 1/3 lived.
Is there commonality on how they pass?
One of the common reasons they passed is if they trapped a major vessel in one of the fractures, they would get a significant brainstem infarct, meaning a stroke, meaning lack of blood flow to a very significant portion of their brainstem. And so that was one of the causes of death that ultimately we understood. And then the others died from the increased intracranial pressure that drove the brainstem down through the foramen magnum.
Did you review any materials that talked about or identified Mr. O'Keefe's body temperature when he was treated?
I see somebody in the chat just came in with the name B. Higgins. Relation to Mr. Higgins?
As I recall, his core temperature was 80 when he was found.
Is that significant in the process and development of his injury from the moment he fell and hit his head until his ultimate passing?
Well,
No, Mike.
hypothermia, if you define hypothermia, it starts
Thank you for answering. I had to know. I had to ask. I'm
at
nosy.
95 degrees. Your core temperature is usually about 98, 98.6. 95 is very mild hypothermia. When you get to 82 degrees, you're in severe hypothermia. What happens when you're hypothermic, and I'm a neurosurgeon, but I can tell you that you get into multiple organ failure. Your heart starts to have problems. It can have arrhythmias. You're not breathing. And ultimately, at hypothermia, you also become unconscious and go into a coma-like state. Below 80 degrees, you're probably going to die. So all I can tell you, it wasn't helpful that he had a significant head injury and that he was then found hypothermic.
Is it uncommon in your experience for people that suffer this injury to pass within 5 hours?
Well, none of the patients we treated died within 5 hours, but it also didn't mean that we didn't realize that they were going to be in a potentially vegetative state. When someone's hypothermic, you have to warm them up in order to establish a clinical status, meaning you can't declare someone dead with a temperature of 80. You have to warm them up slowly, appropriately, and then reevaluate where they are clinically.
I've asked you questions about whether you had an opinion about Mr. O'Keefe and when he died. I want to ask it in the form of a formal opinion. Do you have an opinion to a reasonable degree of medical certainty whether Mr. O'Keefe died immediately or within 15 minutes?
No, I don't think he died immediately. Neither the hypothermia nor this kind of head injury would kill you immediately in any clinical experience I have.
Shop.
Dr. Wolf, thank you.
TikTok shop is great.
If I may have a moment, Your Honor?
Sure.
Thank you.
Okay, so after you put the liquid in these, you're supposed to let it sit for 5 minutes, then take them out, put them on, but don't put them under your eyes, they say. Looks like we're getting Alessi again. Yes, this is actually tested. This is tested for sensitive skin. I can't use it if it's not. I know he's my second husband, just technically my third. But who's counting? We need to use that sister wife sticker.
May I, Your Honor?
Yes.
Morning, Doctor. I don't think we've had the pleasure of meeting. Welcome.
Thank you.
Sir, can you just
Glam, I know.
describe, you started to do it a little bit on direct, a typical day for you?
I wake up at 4:15 in the morning. I go to my center. I set up patients with frames for their either radiosurgical procedures or stereotactic craniotomies. I go home. I make cappuccino for my wife at 6 o'clock in the morning. And then I get back to work at 6:30 and move on. I have patients that I'm operating on, and I have patients that I'm seeing through the day.
What type of patients and what type of work? Just in a typical day. What are you doing? What type of patients and what do you do?
It varies. I mean, I see patients with brain tumors. I see patients with hydrocephalus, which is water in their brain. I see pediatric brain tumors. I see subacute and chronic subdural hematomas, post-traumatic. I see patients with strokes that are being misdiagnosed. I see patients with cancer, metastatic disease. I used to see patients with cervical problems. I stopped doing that 2 years ago. I don't know what else you want me to tell you.
No, that's great. And is that typical day, typical of the type of days you've had for the past month, past few years? Is it generally, without specifics, is it generally?
Correct.
When you get these things, make sure you cut them in half because you don't want a whole circle trying to place it on your face.
So, none of your typical days, none of the past typical months have involved forensic pathology, have they? You haven't acted as a forensic pathologist in...
I am, you could have asked that question very straightforward. I am not a forensic pathologist. I'm a brain surgeon.
Objection. The hell? Combative witness much?
And you don't perform autopsies, correct, sir? You're a brain surgeon.
Correct. In other words, I see more brains than the forensic pathologist.
Right, and is it correct to say that the brains that you see are of living people?
Correct.
Okay, so what I'd like to do
Come on, let's see.
is to go to,
We need a do it sticker too. Remind me that one, do it.
a different part of the head than was discussed, but sticking with the decedent.
Excuse me, I didn't hear the last
I'm
word.
sorry, the topic is going to be Mr. O'Keefe, the decedent in this
Okay.
matter, sir. You testified about raccoon eyes. The medical term for that, sir, is ecchymosis, right?
Correct.
And ecchymosis, raccoon eyes, does not cause a laceration to form on an eyelid, does it?
No,
Are you aware that Mr. O'Keefe had a laceration to the outside area of his right upper eyelid?
I am aware that the ME described that. Yes, sir.
Thank
Now-
you, Crystal.
Could, Your Honor, I'm gonna, with Your Honor's permission, ask to publish what is already in evidence in a moment.
Okay.
Mr. Wolk,
What exhibit number, Mr. Alessi?
we're gonna,
Sounding a bit impatient,
165, Your
Bev.
Honor?
Okay, go right ahead.
Thank you.
You only leave these on for about
Dr.
5
Wolf,
minutes.
have you seen this photo depiction before today?
I believe I have.
Is it correct that that injury on the upper right eyelid is caused by the application of force directly to that area of the front of the head, again, namely the upper eyelid?
That's possible, yes.
Is it more than possible? Is it probable that that injury was caused by the application of force directly to that area of the front of his head?
Well, an easy answer to that would be is that that's not part of the periorbital ecchymosis.
Thank you, sir. That was exactly going to be my next question. This injury is unrelated to any of what you've been describing, the fall backwards, the force transfer inside the skull, the, as you described it, the dura, the cerebral spinal fluid, all of that dynamic that you so ably described on your direct examination. This injury has nothing to do with that, correct?
Correct.
Well, so are you saying you would rather we call him Daddy? I'm not doing that. Thank you, Patricia. Exactly, he is playing chess.
Thank you for answering my questions, Dr. Wolf. A pleasure again. No more questions at this time, Your Honor.
That's it?
Brief follow-up on that?
No, thank you.
All right, Dr. Wolf, you're all set.
Thank you, Sam.
Thank you very
How
much.
are you? But it wasn't, okay. He'll get another chance. There'll be another witness.
May we have a moment to inquire of our next witness?
Sure.
Thank you.
One or two counsel, let's have our jurors feel free to stand up and stretch.
They just sat down. There's only been one witness, ma'am. Thank you. We haven't seen Kat yet today, have we? Did I send it to her? Thank you, Sam. This is turning into a long sidebar. Did they went straight to lunch, didn't they? Bet. Okay, sweet dreams. Get some rest. My favorite girl from yesterday? Okay, thank you. Why would you do that to your dog? We don't support animal cruelty. I'm kidding, you guys. Cat, you see what I sent you? Here we go. And side note, if you guys don't know this, court started today by Bev saying she needed to bring each jury in individually because she was given some information. Something was told to her. She brought each juror up one by one with the lawyers up there at the sidebar, and she questioned each of them. And we cannot, I honestly don't know the outcome, but we just started the day as if that never happened. They're trying to give us palpitation and wrinkles. I sent you your subscription, cat lady. No, Sue. The prosecution hasn't even rested yet. After the prosecution rests, then it's the defense's turn to present their case. And we need to figure this out because Lori Daybell starts June 2nd. We need to figure out how we're going to do this and Lori Daybell. I need help. Someone help me think of a plan, please. I don't know how we're going to do this. We're pointing out the jury. And again, this is just speculation because we won't know. The lawyers cannot tell us what it was about because there's a gag order on the case. In Arizona, that's why we started doing later because they start after us. So we might have to start this. So we might have to start this first thing in the morning. What time zone? Yeah, they start later in the day. We're going to have to start this earlier in the morning and be on all night. Yeah, I'm going to figure it out. We'll figure it out. I don't know how, but we'll figure it out.
Ma'am, I'll remind you, you're still under oath and to keep your voice up. Thank you.
You fell asleep. Yeah, Daybell again. Well, this is her final trial. She'll be conspiring. Well, she alleged to conspire to unalive her niece's former husband while using Tylee's Jeep. It's okay.
All right, Mr. Lally, whenever you're ready.
Thank you, Your Honor.
I see some of you just came in. Just so you know, the way that the day started, we started early because Bev said that some information was brought to her attention. She needed to have each juror brought in separately to the courtroom for a sidebar with the counsel, and she got to ask them questions. Now, there's a lot of rumors about what that is, but we just put it plainly, we don't know. And then they started a day as if it was normal and nothing ever happened after giving us palpitations. Okay, after 5 minutes, we're taking these off.
And ma'am, if you could, just please introduce yourself to the jury again, spelling your last name for the record.
Sure. I'm Christina Hanley. Hanley is spelled Hanley.
The lines went down or up.
And Ms. Hanley, given the break, if we could, if I could just ask you a few questions, just to reorient as far as the items that we were speaking.
That's why I literally look hot my I am not having this today. No, we're back now. Again, people don't understand how devoted we are to the case. We are invested. Do not mess with our time. Don't mess with our Karen Read time. Can you guys still hear me okay? My light is still red. I don't know why. Hi. How are you? All right, let's continue.
All right.
I gave Mr. Jackson my copy, yes, thank you. Showing you a photograph, Ms. Hanley, do you recognize that?
Yes, I do.
And what do you recognize that?
So this is a photograph that I took. It's item 3-2, but it's also, I would have to double check on my notes, but I believe it has item 7-12, one of the pieces that I'm holding, that's showing a physical match between those two items.
You're on a call, seek to introduce in a minute the next exhibit.
No objection.
Okay.
Exhibit 195.
In your honor, may I publish?
Yes.
Ms. Gilman, if I could have
This is prosecution,
photograph 9490.
not Hank though. I like to change his voice.
Ms. Hanley, what's up on the screen, is that the photograph that I just presented to you?
Yes, it is.
And if you could, please describe for the jury what we're looking at here.
So that is a photograph that I took upon examination. It is the clear glass cup item 3-2. And I'm holding another piece, which again, I believe it's one of the pieces from item 7-12. I would need to confirm in my file, but I'm showing that one of the pieces physically fits with item 3-2.
Thank you, ma'am. Ms. Gilman, you can take that down. May I approach again, your honor?
Yes.
Showing you two other photographs. If you can look at those, look up when you're finished. And do you recognize those?
Yes, I do.
And what do you recognize those?
I think we have
So
some time.
these are photographs that I took of item 7-12.
One thing you can be happy with is that they'll take time, so it should be over by the time you get out of your appointment.
Your honor, the Commonwealth will seek to introduce in a minute the next exhibit, A and B.
Let's stop and say
Any
back.
objection?
No objection.
Thank you.
It's 196A and 196B.
And Ms. Hanley, if you could, just remind the jury as far as the physical description that you received in regard to item 7-12.
Sure. So item 7-12 consisted of some clear plastic pieces as well as 9 pieces of glass with broken irregular edges.
And may I publish, your honor?
Yes.
And Ms. Gilman, if I could have first photograph 9476.
Which night mask should we put on during the day? The new one I just got or the collagen one?
And Ms. Hanley, what are we looking at in this photograph?
So this is the photo that I took of item 7-12 as I received it. So there's
The new
the
one?
several pieces of clear glass with broken irregular edges.
And Ms. Gilman, if I could have 9477. As you can enlarge that just a bit. And again, Ms. Hanley, what are we looking at in this photograph?
Those are the same pieces of glass as in the previous photo, just a little bit more up close of the clear glass that was recovered and is item 7-12.
Thank you. Ms. Gilman, you can take that down. Now, Ms. Hanley, as far as a comparative analysis between items in 3-2, the glass cup, and 7-12 regarding the glass pieces, what, if any, conclusions did you make in reference to your comparison between those two items?
Sure. So upon comparing those items, I did note that 6 of the 9 pieces of clear apparent glass had a physical match to item 3-2, the clear glass cup.
And if you could just remind the jury, as far as a physical match, what does that mean?
So a physical match is basically if an item breaks and those items have broken irregular edges, if those pieces come back together like a jigsaw fit, then it's a physical match and they were at one time together as one larger unit.
Now, as far as each of those items within 7-12 had a letter associated with them, correct?
Yes.
And do you recall which of the 6 were a physical match for item 3-2, the glass?
I would just need to refer to my notes for the exact letters.
Sure, you can take your report out.
The 6 pieces of glass from item 7-12 that physically fit to item 3-2 were A, B, C, D, F, and K.
May I approach, Your Honor?
Yes.
Well,
No,
let me ask you.
this is the
first, I'm
pneumatic
sorry. So, Ms.
cube.
Hanley, during the course of this physical match analysis that you're conducting, are you memorializing that process with photographs as well?
Yes, I am.
May I approach, Your Honor?
Yes.
I think this is the brightening one.
And I'm presenting you with 4 photographs, if you could review those. In the
I did a zombie one Sunday when I had no internet. Now this is one of the night wrapping ones. You put it on before you go to bed and you'll be good.
Do you recognize those things?
Yes, I do.
And what do you recognize those?
Those are photographs that I took upon my examination of items 7-12 and item 3-2.
Colonel Gumbo is introducing them as the next exhibit, A to D.
And who handled it too, Britt? Who handled it says a lot, in my
Exhibits
opinion.
197A through D.
May I publish, Your Honor?
Yes.
Ms. Gilman, if I could have 9502, please. And Ms. Hanley, what's up on the screen? Can you please describe for the jury what we're looking at in this photograph?
So this is one of the photos that I took of one of the breaks that physically fit together between item 3-2 and item 7-12.
And Ms. Gilman, if I could have 9514. And again, Ms. Hanley, can you please describe for the jury what we're looking at in this photograph?
Sure. So this is a photo that I took when I was doing my comparison of item 3-2 and several pieces from item 7-12.
Now, as far as the individual pieces had sort of little white stickers or labels affixed to them, is that correct?
Yes.
Is that something that you did, or is that something that when the items were provided to you was already done?
So item 7-12, I received those pieces with the labels already on them.
And again, those items, especially 7-12, had been with Mix Valier in your unit prior to coming to your table or your station, correct?
Yes.
Ms. Gilman, if I could have 9518.
Yes, but stressful as hell. Before the jury, or when the jury came in, she said that she had stuff that was brought to her attention, Bev did, and she would be calling them each in individually, one by one, up at sidebar with counsel, but we don't know the outcome of it. All we know is that they just continued as if nothing had ever happened.
Again, Ms. Hanley, what are we looking at here?
Palpitation, I'm telling you.
So this is another photograph that I took of the physical match. It's just another view of the items together of item 3-2 and several pieces from item 7-12.
It does. It
And
really
lastly,
does.
for this batch, Ms. Gilman, if I could have 9520. And again, Ms. Hanley, what are we looking at here?
So this is another picture that I took of,
That is a lot more than the other one, is it not? There's more to this one than there was for the other one. Hold on. Yep. Okay, so she's saying this part broke off? Yeah, she's saying that part broke off.
fit to several items or several pieces from item 7-12.
Ms. Hanley, is there a laser pointer on the desk in front of you?
Yes.
If
I
you
don't think
could,
it is either.
preferably using this screen just so it's visible for the jury, could you delineate where you see in this photograph item 3-2 and where you see the items associated with item 7-12?
So this right here is item 3-2. And these pieces up here are several pieces from 7-12.
Thank you. Ms. Gilman, you can take that down. Now, the other two items that you analyzed or examined in this part of your physical match analysis were items 3-3 and 7-14, correct?
That's correct.
And turning your attention specifically to item 3-3, if you could just remind the jury as far as the physical description of that item that was provided to you.
Sure. So item 3-3 was 5 pieces of clear glass with broken irregular edges that were recovered from the bumper of the vehicle.
May I approach again, Your Honor?
Yes.
Thank you, Erica.
Do you recognize that?
Yes, I do.
And what do you recognize that?
Sue, how have you been? We missed you.
That is a photo that I took of item 3-3.
Your Honor, come off the seat, introduce in a minute the next exhibit.
All of those WhatsApps are now coming through at the same time, so I take it they fixed the problem. Good. I was getting worried
No
about you.
objection, Mr. Jackson?
No objection, Your Honor.
We've missed you.
And may I publish, Your Honor?
Yes.
Ms. Gilman, if I could have 9446, please. And Ms. Hanley, in addition to the 5 pieces of glass associated with item 3-3, what else is depicted in this photograph?
This is a photo of the 5 total pieces that are from item 3-3.
And in addition to that, is there a ruler depicted in this photograph as well?
Yes, there is.
And what is the purpose of that ruler in the photograph?
It's there just as a scale.
Thank you. Ms. Gilman, you can take that one down. And Ms. Hanley, the last of those items, 7-14, if you could just remind the jury as far as what was the physical description that was provided to you in reference to item 7-14.
Sure. So item 7-14 was a clear piece of glass with broken irregular edges that was recovered from the road.
May I approach again, Your Honor?
Yes.
This literally is the dream team. You see Karen over there working. They're all working. This is a team effort.
Yeah, Ms. Hanley, just showing you a single photograph. Do you recognize that?
Yes, I do.
What do you recognize it?
This is a photo that I took of item 7-14.
Your Honor, almost seek to introduce it as the next exhibit.
All right.
Exhibit 199.
And guys, remember to send me a message on what other stickers you want. Since they just unlocked 10 slots, we can have more.
May I publish, Your Honor?
Yes.
Ms. Gilman, if I could have 9471, please.
Right?
So
And again-
the two screens don't match.
We have one. There's a Binksy sticker. See?
Thank you.
When he was little,
Thank you, Your Honor.
he's a big
Ms.
boy now.
Hanley, again, if you could just describe for the jury what is depicted in the photograph up on the screen.
I'll see if I might have
This
taken
is
out
the
one.
photo that I took of item 7-14.
Thank you. Ms. Gilman, you can take that down.
Not doing a fan one.
So, Ms. Hanley,
Well, no.
in addition to the physical match analysis that you did between item 3-2, the cup, and 6 of the pieces that you found to be a physical match from item 7-12, did you also compare?
Okay. I need somebody to remind me later to make sure the Binksy sticker is in every subscription level. I didn't know it got taken out.
Pieces from item
remind me where you
3-2,
can.
7-12, and 7-14.
Yes, I did.
And what did you conclude in your physical match analysis
It's
of those
not-
items together?
So
So some of the subscription levels have a different amount of stickers. I'm guessing I might have accidentally taken it out and forgot to put it back.
upon examining and comparing
It's supposed
item
to be in all of them, though.
3-2, 7-12, and 7-14, I had concluded that 6 of the 9 pieces of glass from 7-12 physically fit with item 3-2,
She said 6 of 9.
and the remaining 3 of the 9
Mary.
from 7-12 did not have a physical fit to item 3-2. I also compared item 3-2 and 7-12 to 7-14, but there was no physical match to item 7-14.
Now, in addition to that, did you also do a physical match analysis between item 3-2, the drinking glass, 7-12, pieces found from the roadway, and certain pieces from 3-3 from the bumper of the vehicle?
Yes, I did.
And what did you conclude
She didn't seem confident yesterday either.
based on that physical match analysis between those items?
So upon examining and comparing those items, so there were 5 total pieces of glass from item 3-3. I used 2 of those pieces for physical match comparison to the items recovered from the road. Upon my examination, I did not, there was no physical match between those 2 pieces from item 3-3 to any of the pieces recovered from the road. So that included items 3-2, 7-12, and 7-14.
If the glass doesn't fit, you must have quit.
Now, as far as the 2 pieces that you had selected from item 3-3, do you recall which of those 2 lettered pieces you chose for your comparative analysis?
Yes,
And which were they?
they were pieces A and B.
If you're going to come into my lives and tell me your best bet is to run because it's not going to turn out the way you think it will. Not at all.
And if I could ask why pieces A and B versus other pieces?
So A and B were used for physical match. The remaining 3 of the 5 were not used for physical match comparison due to their size and condition.
Now, those same two pieces from item 3-3, pieces A and B, did you then do a physical match analysis between that and 7-14?
I did.
And what did you conclude from that analysis?
I concluded that there was no physical match between the two pieces from item 3-3 to item 7-14.
Now, did you also do a physical match analysis between piece E from item 3-3 from the bumper?
I did not. No, I'm not a physical match examination.
If he doesn't talk about it, then defense will get it. I'll go watch some dudes live who can be quiet during the time, then you go right on ahead. And you know what? Make sure you block me because you're not welcome back in here. Block me and unfollow the hell out of me if you follow me. You don't need to announce. This is not an airport. You do not need to announce departures and arrivals. You don't need to do that. This is not the airport. We don't care when you leave and when you don't. We don't care.
Did you do any comparative analysis between a piece of glass E from 3-3 from the bumper and item 7-14?
Yes, I did.
And what did you conclude from that analysis?
So I selected piece E for further examination. I did microscopic examination as well as instrumental analysis, and I did the same microscopic and instrumental analysis to 7-14, and I compared the data, and
He's already gone.
I came to the conclusion that the piece that I sampled from item 3-3, piece E, was found to be consistent in physical and instrumental properties to the sample that I took from item 7-14.
If you could, Ms. Hanley, could you please explain to the jury when you say instrumental analysis, what is that? What does that consist of?
So the instrumental analysis that I conducted was on the GRIM instrument, which measures the refractive index of the samples. So after I had ran my samples for both item 3-3 and 7-14, I compared the data
I agree, Erica, so
to
far.
determine whether they were consistent or not consistent.
And so when you say that something is consistent in instrumental properties, what does that mean?
So in this instance, they had consistent refractive indices.
In addition to that comparative analysis with the glass items, what other additional examinations did you perform in this case?
Sorry, could you say that again?
In addition to items 3-2, 3-3, 7-12, and 7-14, what other items did you look at in this case?
So I also examined item 3-1 and item 7-18.18.
And what was the description provided to you in reference to item 3-1?
3-1 was a tail light, and there were also some other plastic pieces as well.
And taillight from the same vehicle as the glass from the bumper, correct?
Yes.
May I approach, John?
Yes.
Yeah.
You have another single photograph. Do you recognize that?
Yes, I do.
And what do you recognize that?
This is the photo that I took of item 3-1.
Your Honor, the Commonwealth will seek to introduce those as
No objection. Thank you.
200.
May I publish, Your Honor?
Yes.
Ms. Gilman, if I could have photograph 9394. And Ms. Hanley, do you recognize what's up on the screen as Exhibit 200?
Yes, I do.
And what do you recognize it to be?
This is the photo that I took of item 3-1.
And what's contained in here, is that a fair and accurate portrayal of what the item 3-1, the taillight housing, looked like when you received it?
Yes.
Now, as far as, and we'll get to this more a bit in a moment, but as far as any sort of comparative analysis that you did with any other item, what part of this taillight housing were you comparing to that other item?
So there were clear and red plastic portions of the taillight that appeared to be broken. So I sampled portions of the clear plastic as well as the red plastic on the taillight.
And just for clarity purposes, if you could with the pointer, as far as which of these pieces up on the screen were you sampling the clear and or the red plastic from?
Yes. Before they started today, Bev announced that she needed to see each juror individually, one by one, in the courtroom at sidebar with counsel. Because something was brought to her attention. We just don't know what it is. There's a lot of rumors, but we won't know. Not right now. And then it was business as usual.
So the red plastic that I sampled was from this area. It's a little hard to tell from here. I think I'd have to refer to my photo in my notes, but I think there were a couple of different areas that had clear broken plastic. I think this might have been one of the areas
No.
that was broken that I sampled.
And just for my purposes, really what I'm asking, Ms. Hanley, is the clear plastic that you used from item 3-1 was from the housing unit itself, the large piece, correct?
Yes.
Okay. Ms. Gilman, you can take that down. Now, the other item that you were comparing this to was item 7-18.18, is that correct?
Yes, that's correct.
And what was provided to you as the description of that item, 7-18.18?
So 7-18.18 was debris that was collected from 2 pieces of clothing from the victim.
And specifically, that would be 7-17, an orange t-shirt, is that correct?
I believe that is correct, yeah.
Okay, as well as 7-18, a gray long sleeve shirt, is that correct?
Yes.
And when you say that item 7-18.18 contained debris, what did that debris consist of?
Thank you for the follow.
So the debris consisted of one clear piece of plastic, as well as several pieces of red plastic, among some other trace material.
Now, were there measurements taken of those items within the debris, specifically the clear plastic and the red plastic?
Yes.
And what were those measured to be?
I would just need to refer to my report for that.
Okay, go ahead.
Thank you. Okay, so the clear piece of plastic in 7-18.18, it measured approximately 1/8 of an inch by 1/16 of an inch. And then I measured the largest and the smallest of the red plastic pieces. And the largest piece of red plastic measured approximately 1/16 of an inch by less than 1/16 of an inch. And the smallest piece among those measured approximately less than 1/16 of an inch by less than 1/16 of an inch.
And so those particular pieces that you measured, about how small are we talking about?
So the largest,
She seems very uncertain. Very.
for the red plastic, the largest piece measured, just for visual purposes, it's roughly like the size of a grain of rice. The rest of the pieces were smaller than that.
And who within the lab provided that debris in that taillight housing to your unit, to the trace unit?
So the debris from the clothing was transferred to my unit by Maureen
It is, yeah.
Hartnett. And the taillight was submitted to the lab by Trooper Christopher Moore.
May I approach, Your Honor?
Yes.
Her hands were almost purple red.
Showing you a series of 5
I think she's just, yeah, the confidence issue. She's doing better than I would too. If I was ever on the stand, I expect each of you to tear me apart for how bad I sound, because I know I'll do horrible.
Generally speaking, Ms. Hammond, do you recognize what's depicted in those photographs?
Yes, I do.
And what do you recognize those to be?
Those are the photographs that I took of 7-18.18.
I'm going to come over to seek to introduce and admit as the next exhibit, A through E. No objection.
Thank you. It's 201 A through B.
Your Honor, may I publish?
Yes.
Ms. Gilman, if I could have photograph 9352. And Ms. Hanley, what is depicted in this photograph on the screen?
So this is one of the photos that I took of 7-18.8.
Look at how I do with the 147 of you. I'd be a hot mess. Total mess.
This is how I received the clear piece of plastic.
And is that a tin that it's encased in at the time that you receive it?
Yes.
Ms. Gilman, if I could have 9355.
Clear plastic was collected. Don't know what it was about though. Maybe the tail light? We already went over that, so that doesn't make any sense because it's completely circular. Guys, this face mask that you put it on before bed, and then once it absorbs, it doesn't go on your pillowcase. Don't worry, I'm a big pillow person.
And what is this, Ms. Hanley?
So this is a photo of the clear piece of plastic that was within that tin.
And Ms. Gilman, if I could have 9364. And Ms. Gilman, if you could enlarge this just a bit. Maybe just a little more, please. Thank you.
The hell are we looking
And
at?
Ms. Hanley, what are we looking at in this photograph?
This is the photo that I took of the debris that was collected from the clothing items.
Ms. Gilman, if I could have 9366. And again, Ms. Hanley, what are we looking at here?
This is a photo that I took under a microscope of the red plastic pieces that I noted within the debris.
And lastly, Ms. Gilman, if we could have photograph 9369. And Ms. Hanley, what are we looking at here?
This is a picture that I took of the red plastic pieces that I removed.
Hold the hell on. I know you guys can't see this. Let me pull it in closer. You can't see it. It's too tiny. There's a piece of hair right here that looks like it still has a root attached to it. Right here. You see it?
from the debris.
Thank you. Ms. Goodman, you can take that down. Now, Ms. Hanley, in reference to your comparative analysis from item 3-1, the taillight housing plastic, to the clear and red plastic pieces of debris from debris from item 7-18.18, the clothing of Mr. O'Keefe, what types of instruments did you utilize in this comparative analysis?
Sure. So after completing my examination, I utilized a comparison microscope as well as a polarized microscope, a FTIR, which is Fourier transform infrared spectrometer. And I also used a microspectrophotometer, also known as a microspec.
And what is a microspec?
So a microspec is an analytical tool that we can use to examine samples that have color. So it provides information on the sample's dyes and pigments.
And how is that utilized in your comparative analysis?
So I ran samples from both items that I was comparing.
But did you test that hair that we just saw?
And I compared the data from those two items as a part of my comparative analysis.
And when you run that sort of data, can you describe for the jury sort of what that data looks like? Like what are you physically seeing when you're examining the data from a microspec?
So what we refer to it as a spectrum or just a graph, and when we do the comparison, we can overlay those spectra or graph to determine if they are consistent or not consistent.
And I know you spoke a little bit about it in your testimony yesterday, but if you could remind the jury as far as an FTIR, what is that and how is that used in your analysis?
So an
However, they did test Urey and Proctor later to some things, but it was never clear what.
FTIR is another analytical tool that we can use. A sample is exposed to infrared light and it reacts in a certain way with that light. And what's produced is a spectrum of peaks and
That hair was a dark hair and it looked like a curly hair.
valleys
Long.
that are representative and unique to your sample. And so that instrument was used to run samples from both items, and then the data was compared from both items.
Now, from your comparison of starting with the clear plastic from the debris from Mr. O'Keefe's clothing, from your comparative analysis of that clear plastic to the clear plastic from item 3-1, the tail light, what did you conclude?
So the clear plastic from the debris was found to be consistent in color and instrumental properties to the clear plastic from the taillight. So accordingly, the clear plastic.
You expect us to believe that you found pieces of the taillight on his clothing?
Plastic from the debris could have originated from the clear plastic from the taillight or from another source with the same characteristics.
And with reference to the red plastic from item 7-18.18 from Mr. O'Keefe's clothing, In your comparison of that red plastic with the red plastic from the passenger side taillight of the defendant's vehicle, item 3-1, what did you conclude from that analysis?
So the red plastic that I sampled from item from the debris from the clothing from 7-18.18 was found to be consistent in color, microscopic appearance, and instrumental properties with the portions that I sampled from the red plastic from the taillight. So accordingly, the red plastic from item 7-18.18 could have originated from the red plastic that I sampled from the taillight or from another source with the same characteristics.
I'm sorry, I don't know if I could just hold on 1 minute while the sirens pass. May I approach again, Your Honor?
Yes. Actually, is this a good time to take a break, Mr. Lally? Would you like?
Entirely up to the court. I probably have another 3-4 minutes left.
I'm going to see counsel for 2 minutes, but
Another sidebar. At this point, we don't know what bag contained whatever. Exactly. They were just throwing things in there. We don't even know when it was collected. Except we know that that is the stuff that she says came off of his clothing. Again, anybody, and this is just an opinion, so calm down, guys. It's just an opinion. It's my opinion that that was planted. I'm not used to these kind of opinions. I don't like this at all. This is...
I told you earlier, we're ahead of schedule, so we will take a luncheon break, and we'll take an hour, so I know.
I thought you said it was going to be a half an hour, Bev.
So, we'll just go later.
All rise to the court, please.
Now you see why we do patients with parameter? Because now we have to wait. Let me check the headlines. See what else we have. She did, but now it's an hour. I cannot with that music. Alright, let me see what my messages are.
Alright, fed the kitties. They're done for the day.
Alright, one sec, guys. Okay. So, Sandra sent this one to me. Husband drives 100 miles with wife's body in the back seat after he beat her to death with a baseball bat. The hell is wrong with people? Another add to the list of reasons I don't leave my home. An Arizona man is behind bars after he allegedly beat his wife to death with a baseball bat and drove 100 miles with her body in the back seat. Brandon Gregory, 56, is facing charges of second-degree murder, manslaughter, tampering with physical evidence, and concealment of a dead body and the death of his 41-year-old wife, Allison Gregory, the Surprise Police Department said. Could you imagine working for the Surprise Police Department? You guys know I can't pass up a good joke, right? I don't know. Let's continue reading on. I couldn't pass up that moment. That was a good joke. The investigation began on May 14th when the alleged victim was supposed to pick up a family member from the airport but failed to do so. Family members relayed to cops that Gregory's was going through a difficult divorce. You don't unalive people, you just get the divorce. What is wrong with people? Officers searched the Gregory home where they observed signs that a physical struggle could have taken place. They began searching the couple's vehicle. They found Brandon Gregory in Mohave County in the town of Wickiup. Some 100 miles away from Surprise. His wife's body was in the back seat. They played that wording interesting. Surprise. It was in Surprise and the body was in the back seat. Bad joke. Bad joke. Cops took the suspect into custody. He allegedly admitted to ending his wife's life. Citing court documents reported the suspect said their home was in the process of being sold and his wife told him to leave. Hold on. We're going over other stories because Patients with Parameter is out for the day because they're on lunch. Okay. So her saying leave sparked an argument that turned physical. She kicked him in the groin while holding a wooden baseball bat. He then claimed that he wrestled the bat away from her and she began running around the house screaming. That's when he allegedly hit her several times with the bat and cleaned up the blood before driving the car to a nearby parking lot. After taking an Uber home, he put his wife's body in her SUV and drove away. He ditched her phone and Apple Watch at a gas station. The complaint reportedly said the defendant then went to a campground and threw the bat in an open field. Brandon Gagry also wrote a letter to his children asking them for forgiveness for his actions. Prosecutors noted at a bond hearing how the brutality of this case is alarming. According to courtroom reports from KPHO, the victim's family urged the judge to keep him behind bars and described the couple's volatile relationship. He lied and manipulated his way back into her life. She uncovered more lies, lie after lie, he said. The guy's entire life has been a lie. Aaron, this is going to be an episode of Who Did I Marry? Bet you.
Well, no, because she would have had to be so...
That's true. Never mind. Can't be because they'd have to still be alive. Okay. This guy's entire life been a lie. He's a manipulator and a murderer. We ask you to deny any bond and don't ever let him out again, said her mother. Allison struggled so hard to get away from him, and she was so close to it. He took her away from us. Please, please do not ever let him out again. It's horrible. My grandchildren, my children, it's so sickening. He is such a coward. If he wanted to unalive somebody, why didn't he unalive? I can't say that one. I'm sorry. I think that's it, Brandon. I hate you forever. I hope you never, ever, ever get out of prison. And then the judge sent a $2 million bond. His next court hearing is scheduled for today. She was a Navy veteran, guys. A devoted mother to 2 daughters, aged 20 and 14. So like I said, another reason I don't leave my house. What is wrong with people? This background music is gonna unalive me. The elevator music or whatever the hell they put on. We're just gonna play this one instead. Our Patients with Parameter is broken today because we had to start early. Okay, I can feel my skin starting to finally tighten from this mask. You can't even tell it's even on.
As your sheriff, I take full accountability for this failure.
Do you though?
In the community about notification and communication.
Good morning, Council. Because of the complexity.
Today, New Orleans City Council members spent hours grilling Sheriff Susan Hudson about the jailbreak at the Orleans Justice Center where...
Thank you. Okay.
10 inmates escaped. Council members questioned the sheriff about the delayed response, the lack of...
What'd you say, Aaron?
I said I just fed the cats.
Okay, did you do the litter by chance?
I did it yesterday.
Thank you.
communication and the lack of funding that may have contributed to the escape. Thank you for watching, everyone. I'm Katie Moore.
And I'm Sharice Gibson. We'll get to that meeting.
Is it a family annihilator again? I don't know what the hell's going on with people. Stop unaliving people.
In just a moment, but first, the latest on the manhunt and that investigation. 4 escapees are now in custody after the 4th. Gary Price was caught yesterday. We brought that to you as breaking news last night.
State police say those 4 inmates were transferred to the Angola State Prison. NOPD says the remaining 6 are likely still somewhere in the city. Meanwhile, we're learning more about the alleged inside man, the jail maintenance worker who was arrested and his alleged role in the jailbreak.
Yeah, Paul Murphy's joining us live now with those details. Paul?
Katie Charisse, law enforcement sources have been telling us that it is doubtful that 10 inmates could escape from the Orleans Justice Center without help from inside. And tonight we're learning that may have been the case. A maintenance worker at the Orleans Justice Center is now facing serious charges. Investigators said he has confessed to helping 10 inmates escape from the jail. According to court documents obtained by WWL Louisiana, 33-year-old Sterling Williams told investigators he turned the water off from the outside pipe walk area on the exterior of cell 6.
Yeah.
Using an unknown apparatus, the inmates then sawed through steel bars behind the sink toilet unit, removed the unit, and escaped. Tuesday, Sheriff Susan Hudson, who runs the jail, told members of the New Orleans City Council there were procedural failures, missed notifications, and intentional wrongdoings.
This was a coordinated effort aided by individuals inside our own agency who made the choice to break the law.
Hudson also revealed several OPSO employees have been suspended without pay and more disciplinary actions are under review.
They're just suspended when they some of them were convicted murderers, some were on trial for murder, and some were just violent crimes. The one left to get food. Well, this one cut off the water to the cell because he said he had a shank. So he felt that he had to do it.
One arrest has been made, and we are continuing to pursue everyone involved.
Right?
And that investigation is active and ongoing.
According to investigative documents, William claimed he acted under orders from escaped inmate Antoine Massey, who allegedly threatened to shank him if he refused. Louisiana Attorney General Liz Murrow isn't buying that defense.
I think that he made some bad decisions. I mean, I don't think that he had to do any of the things that he did. And, if he was under threat, then he certainly should have brought that to someone else's attention.
Williams has been booked with 10 counts of principal to simple escape and 1 count of malfeasance in office.
We have no idea why the day started with Bev telling all the jurors that she had to see them one by one at sidebar with counsel. We don't know. And we're not going to find out from the lawyers because they're under a gag order. The only person that could say anything would be Karen and anyone that heard anything. Bye, love you. Drive safe.
See you afterwards.
Charges are felonies.
Our intent is to make sure that this never happens again. And so, we're going to look at all the things that we need to do to change those conditions and at the same time hold everyone accountable that may have been involved before, during, and after.
And AG Murrow also emphasized that this investigation will eventually uncover all of the facts. And she warned anyone caught aiding and abetting.
Are you serious, Kayla? You don't play around with this. Some of these people are murderers.
These escapees will be prosecuted to the fullest extent of the law. We're live outside the Orleans Justice Center. Paul Murphy, WWL, Louisiana.
Keep in mind, they said if you do see anybody, do not approach them. They are considered armed and dangerous. Yeah, that's a speculation. Thank you for clarifying that it was a speculation, Becky. I appreciate it. That's all it will be right now is speculation. That's all it will be. Nope, we still got, is it 5 more or 6 more? Hold on. Didn't you say one? So isn't it 5 more, Sandra? Okay, I want to make sure I was right. Okay. And there's still no noise on this one. Unless I unmute it and then we hear elevator music again. So hold the hell on. Let's see if there's anything about what happened. I doubt it, but... Damn. A motorcycle clocked it going 102 miles per hour. I don't know how some of the shit gets on my first page. No, there was 10. The extra one, he was moved to a different cell and they didn't track it. So they found him. Good afternoon, Marie. How are you? Let's put that one on the back burner for right now. I don't know how much more of this I could take in. Hold on. Yeah, they can't talk. Oh, I thought you were talking about I thought you were talking about Karen Reed's case. They're not going to talk, no. Oh, here's one. I don't know if... Court TV is anti-Karen Reed. A 5-second recap? Yes, I'll try. So everyone came in. She needed to see the jury by the sidebar, one by one. Sidebar, no one else there, no cameras on, nothing, no recording of any kind for something that was brought to her attention. We don't know what that something is. There's a lot of speculation. There's speculation that it was the laughing that jurors were doing and possibly communicating, their reactions, and that rumor that they were possibly separated. We just don't know. And we won't know because they're under gag order. So the only person that could speak is Karen or somebody that knows something from inside the courtroom. The lawyers cannot legally speak. That's sick. I've never, ever had this happen in any case I've been covering. Never. Look at me sitting here trying to act like I'm a trial professional now. I never have though. Never. In the middle of a trial, to speak to jurors one by one with the camera off and no one could record anything. No, I haven't. What'd you say? I know, right? But this isn't the first and only case I've covered. I cover a lot of cases. This is just the next one that was requested. To be completely honest with you guys, I thought Karen Reed was guilty by just my own personal bias. I looked at her and I don't know how or why, but I made a judgment. I thought she was guilty. I feel horrible. I've learned my lesson. Hold on.
And 1 a.m. was about the earliest that they could have this meeting.
All right, good.
Have you guys tracked anything about a shooting at a sports bar in Arizona? The pictures it's showing are nighttime, so I don't know when it would happen. And we didn't. And I bet you one thing that they never wanted was all of our eyes on them right now. Diddy's stash location has been exposed. He carried it on him. I don't even know how some of this stuff pops up here. I know, right? I had somebody come in yesterday. Was it yesterday or was it this morning? No, it was yesterday. I've got Karen Reed's face on there. I got the witness on there. And they're asking me if this is Diddy. I'm really tempted to go check her TikToks. But it would be a violation of virtual jury guidelines, I think. I want to know what she said. But it would be the telephone game. It sure has, you're right. Hey, okay, let me tell you something. We had to start early today. That's why I look Hot Mess Express. I had gotten messages when I was still in my bedroom, still laying in bed, making another video of yesterday's proceedings, when I got a bunch of messages blowing up my phone because Bev needed to interview the jury one by one by one. Only one at a time, with no cameras on, no recording whatsoever. And she had them all at sidebar one at a time with counsel present because something was brought to her attention. We don't know for sure what that something is. We're just hearing lots of rumors. And some of us are, wanting to know what those rumors are. But that's all it will be at this time is rumors. There's a lot of speculation. But then they preceded that with acting like nothing ever happened. Like the whole world wasn't just sitting here. The whole world of people interested in it. We're just sitting here. And we had to wait. Not even the fan was spinning. But there's rumors that it was ones that were laughing the other day had to be separated. I just don't know. I don't know. And the lawyers can't say anything because they're under gag order. So, yeah, somebody in the courtroom. We may never know. Well, we'll know, but just not right now. I love you guys, too. Okay. Let's just see if they're back yet. Court TV, you need better elevator music. Have you guys ever comment stalked when there was a court thing on? Like you go in there and you read all the bullshit they say? Oh, here it is, right here.
So, an issue has come to my attention that is going to make it necessary that I talk to each one of you individually over at sidebar with counsel. So that process will take a little while. So I'm going to don't speculate as to what I'm going to talk to you about. Please, when you go back to the deliberation room, talk about anything but this case, and I'll see each of you individually. And the process may take the cameras will be shut off, and I'm going to talk to the lawyers about no.
Really, Stacey? Aaron got one too, but he doesn't have to do it.
All right, send it out. Thank you very much. So,
with Wolf's testimony, I cannot, with his testimony. He's a neurosurgeon. He's trying to say how somebody died. Okay. But he's saying that it was because he fell backwards and hit his head. That's why he has those bruises on his eyes. Yeah, lunch break. Lunch break. When the medical examiner that testified last week told us that you cannot get them from falling on the backyard, you cannot get bruises on the front of your face. So, I saw him as a shady witness. What did you guys think with that guy? With Isaac Wolf? He reminded me of that guy from the Burbs.
You can't tell me that.
So, an issue is.
You can cut lamb.
I think so too. Okay. Has anybody went and checked Boozy Beauty's TikTok? He reminded me of the guy on the Boonies, the neighbor, the one that moved in that was a doctor that was scary, really scary. Oh gosh, hold on. I'll just show you. It's the easiest way to do it now that I found it. Hold on.
So, an issue has come to my attention that is going to make it necessary that I talk to each one of you individually over at sidebar with counsel. So that process will take a little while. So I'm going to don't speculate as to what I'm going to talk to you about. Please, when you go back to the deliberation room, talk about anything but this case, and I'll see each of you individually. And the process may take the cameras will be shut off, and I'm going to talk to the lawyers about no filming.
I caught something we didn't catch before. The courtroom was cleared during the questioning. So there is nobody that could tell us what happened in there because they couldn't see and hear it. They did clear the courtroom. I didn't notice that part before.
All right. Send it out. Thank you very much.
Yes,
So,
those neighbors.
an issue has come to my attention that is going to make it necessary that I talk to each one of you individually.
So that's how we got into the speculation pool that we're in now. This is pure speculation. I don't have anything factual. But can somebody go check Boozy Beauty and see if she has something, because you said she was there. Did she post anything? Keep in mind, whatever anybody posts right now is going to be speculation. But we can speculate. We're only human, right? I'm so not used to this. You know about the witnesses having to be questioned before court, right? Oh no, did she say anything? Please tell me she heard something. It would just be speculation. Okay, so Isaac Wolf says that the injury that the back of his head caused his raccoon eye bruising. Okay, thank you. I can't watch that video because I'm part of the virtual jury and it will violate my oath. Yeah, they cleared the courtroom, guys, so it would be pure speculation at this point. I wonder if he forgot his phone on record. Well, he forgot his jacket too. Let's see what else we got.
I think after seeing these kind of people are sympathetic to Karen. So thanks, Hank. Keep it up. You got about 30 some more to go. So they're going, hey, is Karen starting to make sense, or she's the only one making sense and not lying to us? I think after seeing these kind of people are sympathetic to Karen. So thanks, Hank. Keep it up.
We don't know. We may never know. We don't know why they had to all go one by one before we started today. We just don't know. Multiples. Really? I've had a couple videos sent to me by her. I have watched one or two, but it didn't violate. Technically it should have, but okay, what do we got here? That's what I'm worried about. I'm worried about that they're going to make it seem like they're letting it go and then come around later and say, nope, remember this moment? Oh, I missed it. Really? At this point, if they're not, you have to start wondering if they're a plant. Again, I'm not used to having a question if somebody's a plant in a trial. The fact that we even have to sit here and wonder if someone in the jury is a plant is asinine. I cannot believe that we're even doing this. But here we are. Court is set to resume in 10 minutes, guys. 10 minutes. So if your drink is running low, go refill it. If you need a snack, go get it. If you gotta use the bathroom, go do it. And I'm gonna take my own advice. I'll leave the elevator music on. I'll be right back. This is the weirdest case I've ever covered. What'd I miss? Anything good? I blew my nose and it ripped off some of the mask. Good afternoon. How are you today? This is so satisfying. I'm doing alright. How are you? We had to start early today. Casey Anthony will always be free, sadly. What do you think you missed? Something if your screen is frozen? I don't know what you're trying to ask there, Jody. Could you reword that? I hope they do too, Brandy. Can you guys hear me? Jody, it says it's paused. Can you guys tell Jody to... Jody, if you can hear me, leave and come back in and see if that fixes it. No, I stepped away for a moment. I got so much of this in my hair. Hold on. Okay, so the stuff that we were set was the Medicube. It's the night mask, but I wanted to try it anyways. So we did it. Only kept it on for a little bit because I accidentally messed it up when I blew my nose. So this is the brightening one, guys. For brightening, for age spots. Damn it, I missed another spot. Okay. They should be back in just a minute, guys. Jody, exit and come back in. Do I show pause for anybody else? I don't know why it's showing you that, dear. No idea. I'm up here. I keep finding parts of it. Yeah, Jody, sadly, it would be something on your end. Try closing the app and reopening it. I forgot that I put it all the way down here. Now, ideally, when you put the mask on, it's when you're going to bed at night, so you don't take it off an hour later. I just wanted to try it. Yeah. I want to do them a lot more, though. Especially since we all need a Karen Read support group. And we decided we need one. I think I'm going to start doing that tomorrow evening. Yeah, we totally do. I've never been... This is a different type of invested in a case because you're seeing someone whose entire life is on the line. How this, if this could happen to her, it could happen to us. And that's what's so scary. That's why so many people are obsessed with this, because we cannot let this happen. No. Hey, Michelle. My brother wants me to do a live with him tomorrow night. What's happened to others? But, you know, you have to wonder how deep the corruption goes. I can only hope that there's no plants on the jury. I could see that happening. Oh no, I'm not trying to be seen. I'm trying to make sure everybody else could see this. I don't know what to tell you, Jody. I'm sorry. But the fact is in the justice system that we have today in this country, knowing that this is happening and coming face to face with it are two totally different things. Oh yeah, absolutely, Taylor, 100%. We're gonna have a party. If not, I need to plan something else. I mean, okay, you guys are 7 minutes late. Come on. This is why I don't like to do it live. Patience with parameter is my best form of practice. No, it's not even rested yet. This is still the Commonwealth's case. They haven't even rested yet. Once they do rest, then it's the defense's turn to present a case. So you guys are on the same page as me? Patience with parameters, right? I don't like this. So how are we we need to figure this out. How are we gonna cover Lori Daybell's trial on the 2nd and the rest of Karen Read? We need to figure this out. What we might have to do is once the 2nd of June comes, we might have to start Karen earlier in the day. So we might need to go to live. And then in the evening, do Lori Daybell's. But that means basically 12-hour lives. I don't know what to tell you, hon. I'm sorry. Yeah, remind me to order more face masks because I just finished with the April Skins. I still have, I think, 3 Medicube ones. The ones that you leave on and they turn invisible. Yes, we actually saw that happen live, Julie. Let me check something. They're back. Well, we got Mila trying to co-host in the morning. Binks will definitely have to step up. And before Lori Daybell starts, we're probably going to need to try to get some more mods too. It gets crazy.
Hey, this court's back in session. Please be seated.
I think I'm overworking my mods.
Whenever you're ready, Mr. Allen.
Thank you, Your Honor.
You need a Trimetacube.
Now,
Jody, that was the screen that was the waiting. They were on lunch.
Ms. Hanley, when we left off, you were discussing the comparative analysis you did between item 7-18.18, Mr. O'Keefe's clothing, and item 3-1, the taillight housing or the plastic within the taillight housing of the.
So far, just that the piece, not all the pieces matched. If the pieces don't fit, you must acquit. Oh, my misunderstanding. Yeah, I was waiting. That's why I kept saying so many minutes late. We were waiting in that
The
horrible
defendant's call, correct?
elevator music with that voice.
And there were a number of different instruments that you used through the course of your examination and analysis, correct?
That's correct.
And what were those instruments that you used again in that portion of the analysis?
Sure. So I used a polarized light microscope, a comparison microscope, an FTIR, and a microspec.
And Your Honor, may I approach?
Yes.
Showing you 3 documents, if you could review those without me finish, please.
I know, I was saying that too, but we have a lot
Do
of
you recognize
cases
those?
at one time.
Yes, I do.
And starting with the first page of that 3 pages, what do you recognize that?
It is the FTIR comparison data for the clear plastic from item 3-1 and the clear plastic from item 7-18.18.
If I could direct your attention to the second page within that, what do you recognize that?
So this is also FTIR comparison data from for the red plastic from item 3-1 and item 7-18.18.
I knew you would.
Lastly, the third page within that set, what do you recognize that?
So this is the comparison data from the microspec, from the red plastic from the item 3-1 and the red plastic from 7-18.18.
Sadly, they're not sequestered here.
Your Honor, the Commonwealth will seek to introduce and admit as the next exhibit individually.
No objection, Your Honor. All right, thank you.
Do you want them marked individually or just in a set?
Individually, please. Thank you.
So we might be going from 8 till 9 once Daybell's trial starts. 8 a.m. to 9 p.m.
It's 202, 203, and 204.
Thank you.
And again, Ms. Hanley, when it came to your analysis of the clear plastic material from the debris from John O'Keefe's clothing and the clear plastic material from the defendant's taillight, what were your conclusions from that analysis?
Sure. Upon comparison, the clear plastic from item 7-18.18 was found to be consistent in color and instrumental properties with the clear plastic from item 3-1.
They did start late today because she had to question each juror individually for some cause that we just don't know yet. They normally start every day at 8, but it was late today.
Accordingly,
I mean, if you ask me, at this point you have to start wondering if the witnesses that they have is because they're trying to get a mistrial on their own, the Commonwealth. Because everybody would know that these are... I'll stop.
the clear plastic from 7-18.18 could have originated from the clear plastic from item 3-1 or from another source with the same characteristics.
It doesn't feel right to me
Your Honor,
either.
may I publish, and I'm sorry, I forgot already the exhibit numbers, but Ms. Gilman, if I could have the clear plastic.
I'm glad that you understood that. You knew where I was going with that.
And Ms. Hanley, Can you describe for the jury what we're looking at in this, what's up on the screen right now?
Sure. So this is the FTIR comparison data of the clear plastic from item 3-1 and the clear plastic from item 7-18.18.
And Ms. Hanley, if you could, using the laser pointer before you, if you could direct the jury's attention to which is which as far as the top and bottom.
She does, doesn't she?
The top,
That's okay.
Yes, that just happened. And if you're going to ask me what just happened, somebody's phone went off and they were playing all kind of music.
source with the same characteristics.
Thank you, thank
And Ms.
you.
Gilman, if I could have the,
Am I frozen? Anybody frozen? Or better yet, are you guys good? Can you guys hear me and see me? I don't know what is going on today with TikTok. We're going to try frownies for about an hour and see what that does for these massive wrinkles that they're putting into my skin by stressing us out, giving us palpitations.
red plastic data.
I do, Mary, sadly.
And Ms. Hanley, directing your attention to the screen again with the laser pointer, if you could delineate for the jury as far as which.
You guys didn't hear it? Hold on.
On bottom.
Sorry. The top,
That's okay.
Somebody's cell phone was ringing, music in the courtroom.
the top spectrum is item 3-1 and the bottom spectrum is item 7-18.18.
And Ms. Hanley, when you're comparing these two as far as the data that you receive, what is it specifically that you're looking at in your comparison as far as the data is concerned?
So when I'm comparing the spectra, I'm looking at the peaks in each sample to determine if they are consistent or not consistent.
But if you think about it, though, what do they listen? We can, if they do get a mistrial and they do try her again, we're gonna have to like protest or something. This cannot stand.
Thank you. And if I could turn your attention to the red plastic material from the debris from Mr. O'Keefe's clothing and the red plastic from the passenger side taillight of the defendant's vehicle, what did you conclude in your analysis there?
So upon comparison, the red plastic from 7-18.18 was found to be consistent in color, microscopic appearance, and instrumental properties with the red plastic from item 3-1. So accordingly,
But at what point is that a violation of her rights?
red plastic from 7-18.18 could have originated from the red plastic from item 3-1 or from another source with the same characteristics.
You sure did.
Thank you. And Ms. Gilman, if I could have the red plastic.
Someone gifted
data.
you one.
And Ms. Hanley, directing your attention to the screen again with the laser pointer, if you could delineate for the jury as far as which set of data is associated with which item.
So the top spectrum is item 3-1 and the bottom spectrum is item 7-18.18.
Thank you for getting us to 31,000 taps, guys. I do greatly appreciate that. And thank you for letting me know showers. Sometimes I get distracted. Well, when we get to 85, I can gift more subscriptions because they give you freebies. But these ones I did today, I bought them. So I can't do any more until we get to where they give us more freebies. Sorry, guys.
And again, if you could direct the jury's attention with that laser pointer to the areas as far as the data peaks and valleys that you're looking at in comparison of this data.
And side note, it unlocks more stickers the higher we go. So I can now make us more stickers. So send me your messages on what stickers you want.
So when I'm comparing them, I'm comparing the peaks to each other in each of the spectra to determine if they are consistent or not consistent.
Thank you, JK. I've never gotten one of those before. That was super cute. Thank you so much.
And in this case, you found them to be consistent. Is that correct?
That's correct.
And Ms. Gilman, lastly, if I could have the microspec data. And Ms. Hanley, if you could describe for the jury, please, what are we looking at in this particular data set?
So this is the comparison data from the microspec of the red plastic from item 3-1 and the red plastic from 7-18.18.
And as far as the data in any microspec, but particularly this one up on the screen, using that laser pointer, could you illustrate to the jury sort of what these individual lines or what this data means?
So these are the samples that I ran, and they samples that I ran from item 3-1 and 7-18.18, and the spectra are overlaid in order to determine to look at it and to determine whether they have a consistent or not consistent pattern.
And from overlaying the data from the pieces of plastic from Mr. O'Keefe's clothing and the pieces of plastic from the defendant's taillight, what do you observe as far as from overlaying those two?
Don't forget, in case you missed it, they were showing the pieces that was taken off of John O'Keefe's clothing. And in the bunches of stuff, there was a really long hair with what looked to be a root connected to it. Bet you they didn't test it though.
Two sort of data points.
So I determined that
that
they had consistent microspec data.
Again, if you